welcome everyone to Road to Residency for the Urology Information Session. We're just really excited to see everyone tonight. I know that there are some non-fourth year medical students, and you're of course welcome. Just know that the questions are going to be primarily directed towards fourth year medical students who are going through their application process on ERAS, and so keep that in mind. If we have any time at the end to ask any other questions, like about performance on sub-Is or things that M3s typically are more concerned about, we would definitely try to fit it in. This is a session that was put on in collaboration with Tour for Diversity, Urology Unbound, and SNMA and LMSA to prepare fourth year medical students. And we thank all of these organizations for putting this together. I'm Amisha Tutwiler, a third year medical student and the new intern at Urology Unbound, and I'll be your moderator for tonight. For students, if you have any questions, we're going to have a Q&A section at the end. So we ask for you to, at that time, you can raise your hand and I will call on you, or you can also put the question in the chat and I'll ask it for you in case there are, any shy people in here. And let me see if Dr. Rich is on yet. What I'm going to do next is we're just going to move forward and I'm going to introduce the panelists. What I would like you to do, panelists, is I'll just share in this order. If Dr. Rich comes on, then he'll obviously be last, most likely. And just share where you're from, what position you currently hold, and something interesting about yourself, what you like to do in your free time. And we can start with Dr. Polina Ray-Blatt.
Hi, thank you for having me on the panel. This is always an exciting but also very stressful time of the year for everyone. I am in Los Angeles. I'm chair at the urology department here at Kaiser Permanente Los Angeles Medical Center. What else? I'm also sort of a co-director of the gender affirming surgery program within the Southern California. And interesting fact about me, I was born and raised in Riga, Latvia. It's a small little place in Eastern Europe, and I moved here in mid-90s. What I like to do in my free time, I run, clears my mind. I listen to classical music in the OR, irritate all my residents by doing that. That's all.
Classical music is underrated, I swear. It's so relaxing.
100%.
All right, and Dr. Elodie De Lavanza, welcome.
Thank you. I apologize. For some reason, my video won't start. I'll keep trying to troubleshoot. But in the interest of everyone's time, I wanted to just stay connected. I'm Elodie De Lavanza. The introductory slide is, as of 2 weeks ago, inaccurate. So I spent my first 6 years of practice at Brigham and Women's Hospital in Boston. And I've recently transitioned to University of Southern California, where I'm a specialist in female pelvic surgery and reconstructive surgery.
Yay!
So,
go
yeah. So the Los Angeles contingent.
Oh my God, that's exciting.
Yeah, the Los Angeles contingent has gotten bigger. I'm originally from Los Angeles. Interesting thing about me. In childhood, I was in a sign language singing group. That's it.
That is so cool. Do you still know sign language as well and practice it with your patients?
I use my limited sign language when I can with my patients, and it is appreciated, but I'm by no means fluent.
That is awesome. Okay, and Dr. Yahir Santiago Lastra.
Hey, everybody. I'm Jair Santiago. I am a urologist at UC San Diego Health. But fear not, for those of you East Coasters, I have built my practice at UC San Diego, but I actually am from Puerto Rico. I went to medical school there. I did my residency on the East Coast in Boston. I did my fellowship in the Midwest at Michigan. So I've experienced all the flavors that the United States and its colonies has to offer. So I have some good perspective there. I think what I like to do in my spare time, I love to draw and illustrate. It's super fun way to de-stress, and I really love it. Sometimes I should be doing closing some charts, and instead I choose to draw for fun. So definitely procrastinate there. A fun fact is actually I went to college with Dr. De Lubanza. So she and I go way back, and I don't think either of us had any intention of being urologists, and like randomly ran into each other at a course, and we were like, "What the hell are you doing here?" And that was pretty awesome. And I consider her a wise woman and one of my best friends and mentors. So I'm excited to see her here on the call. I'm excited to see all of you. And I think Dr. Rich is on now, so we can transition to him.
Yes, welcome, Dr. Rich. What we're doing right now is introductions. Thank you so much, and we apologize for the technical issues.
All good.
What we wanted to do is just have you introduce yourself, say what your position is, what type of urology you practice, and also something interesting about yourself, like what you like to do in your free time.
Sure, no problem. So my name is Chad Rich. I'm a urologic oncologist. I'm at the University of Miami Miller School of Medicine. I'm an associate professor. I've been here since 2014. I did my med school at University of Chicago, my residency at Columbia, a fellowship at Vanderbilt, and then University of Miami was actually my first job out of fellowship, and I've been here since 2014. Things about me. So I'm originally from Jamaica. I was born and raised there, came to the States for college, and pretty much have been here since then. My family is still there, so I always go back a couple of times a year to go visit them. And Miami is an easy place to jump back and forth between Kingston and South Florida. Other things I do, I chase after my children. I have 3 of them. I have a 10, a 7, and a 3-year-old that occupy most of my waking hours outside of residency, outside of work. And then other fun things I like to do are car racing, weightlifting, and going to the beach.
Very cool. What I'm going to do is move on to our questions, and panelists, feel free to chime in if you feel like you can answer the question. This is a very relaxed environment. We just want it to be conversation style. So the first question is, with step 1 being pass fail, how has your program shifted to make up for this lost metric? And what have you heard from your peers in academia about this for the upcoming application cycle?
I guess unless Dr. Riblet, who is a chair, may be a good person to speak, I'm happy to jump in.
Go ahead, jump in, and I'll follow.
Yes, I don't think anybody really knows. The last cycle of applicants was a mix of people with and without step 1 scores. I would say that what seems to be the trend is that those without step 1 scores take step 2. And those are used as a sort of a surrogate. I think people are looking also at rotation grades, research, letters of recommendation, the rest of the application. I don't know how I personally feel about it. I have always thought if we were going to use step 1 as a metric to help people or to select people, we should allow them to take it as many times as they wanted to in order to get the score that they thought was reflective of their abilities. And so I think this is in many ways a positive change, but I'm not sure where we'll go. And I feel like a lot of programs feel the same way.
I will second that. It's, again, we don't know how to feel about it, and we don't like change in general, right? Humans don't like change, and I've done it for more than almost 15 years, and this is just different. But we knew it's going to be pass fail even the prior cycles. So what we did sort of practicing is we kind of try to make step one blind and see if it changes our selection process. And it actually didn't change things a lot because we were sort of moving towards the holistic approach earlier than probably maybe we're a little bit ahead of the curve. And that just, and when things would get heated during certain debates, I said, pretend you don't see it. It's like that, the piece of information will not be available anymore. And last year there was a mix and we definitely tried to blind it. And this year, while most people will not have step ones, remember there's some people who will, people who took it and took a research year or people who are applying again. Because if you've taken a step one, it cannot sort of evaporate. It's still there on the application. So we've discussed it. We decided we're going to definitely blind that piece of information. So those few people who have it, we will not be able to see it. Or our reviewers, our panel that reviews will not be able to see it. So, but yes, everybody is a little, because as everything in medicine, right? It takes 10 years to really tell us whether it's good or bad or neutral. We don't know if what we're doing now, how it's going to affect you as future urologists 10 years down the line. Probably won't, but time will tell.
Dr. Santiago?
So I think for the students on the call, the way I might recommend looking at it is that, you know, you have every individual student gets like a series of points, and whether the programs are actually using a point system to grade you in different categories, or it's like a mental exercise if people are more trending towards a holistic application review versus another. The reality is that all of these domains of the application, the step score, the recommendations, the grades, etc., they're all kind of check boxes that you have to meet, criteria that you have to meet. When you are underrepresented, it's almost like sometimes for certain programs, you actually have to meet and excel in all the boxes to really be noticed. And that can, you know, that can feel like a burden. And sometimes it really is. So what I would say is we don't know if having it be pass fail lightens the burden or actually just transfers it to something else. But I think that studying for the step and trying to make sure that you have a great way of learning information and being able to take that information and you excelling with it on a test or excelling with it on a rotation to demonstrate fund of knowledge, all of that is really important still. So as far as you in preparing your application and preparing yourself for rotations, et cetera, the pressure is just shifted towards other things because applying to urology is still going to be competitive. Many programs are still going to look at the step 2 score, and their laser focus is going to be directed towards other things. And that's going to include the letters of recommendation and your performance on rotations and your research publications, and then other criteria that certain programs have, like where you actually trained or where you actually did your sub-Is or who actually wrote your letters. That's not to put pressure on anyone, but just to say, don't worry so much about whether it's pass, fail, etc. And if you are happy with your step 2 grades, great. If you're not happy with it, really look at your whole application and say, do I have all of the boxes checked appropriately for everything else so that I'm still a solid candidate? Or do I really need to rethink how competitive I am for a specific cycle? And do I need to do other things to supplement my application so that programs will catch notice of me and still consider me a worthwhile applicant?
That was really good advice from everyone. Thank you. On to our next question. Is urology-specific research important? What if a student shifted from a different specialty to urology late in the game, or they don't have a lot of urology research or any urology research? And we can start with Dr. Rich.
Thanks. It's not so much that urology specific research is important. I think what's important is that you've shown kind of an interest in the field, sort of that distinguishes you from, other applicants by looking and seeking out some sort of project in urology. So it does, at least in our program, tend to set people apart when they're like, oh, this person did a project in prostate cancer, or this person did a project in kidney stones. And then, it's obviously something that we as reviewers can relate to, whether it's an endourologist reading your application. So it is a tool that can help distinguish yourself from your peers. And I think it was mentioned before, we're looking more holistically at things. So you do have to look at things like what type of research project did they do? Was this initiated by them? Were they just kind of trying to check a box and just be a part of a urology project? Or was this something that they said, hey, I, have this idea, came up with this thought and from being in clinic with Dr. So-and-so, and I wanted to pursue it in the form of research. Like those are impactful research ideas and endeavors. So it's really the intent of the research that sets you apart, not 100% necessarily this specialty, but it does help if it's in urology. But again, at the same time, if you, let's say, started out doing GYN and you started your work with a gynecologist and you were very passionate about it, it still shows that same drive that you thought of an idea, did a project, had a question, followed it through to the end. That is something that will certainly set you apart. So if you shifted from being interested in GYN or Sir Jonk to urology and you did research and it showed your drive, intent, passion for doing scholarly work, I think you're not going to lose that much. But most programs, they always have a few projects going on that you can jump into. So I think if you can get on a urology project, it helps, but the intent is what's important.
Dr. Ryblatt, what are your thoughts on that?
My thoughts and maybe sort of advice is probably having no urology research will not help you. Kind of going along the lines of what Dr. Santiago Lastra was saying, like what makes your application the strongest. And we do see people changing focus, right? As Dr. Rich was saying, you start with one thing and somehow you shift. So having research other than urology is very widely, we see it a lot. And also having a lot of research in one field and then shifting interest to urology, it's also very common. But having a sort of ERAS application full of head and neck research and then, or ortho, we see it, right? Because we all choose and we're surgically inclined, tried all these specialties and maybe the mentor was an ENT and then you realize urology is your thing. It's not sort of a sin or a crime, but if you have absolutely nothing in urology, it's just difficult because your application sort of competes with a lot of other applications. So either it needs to be reflected in personal statement and somehow give a little bit of an explanation, or you need a little urology sort of, sprinkle in there because it will look, I'll just be frank, if I'm looking at an application that has zero urology anything, it just will look strange. That's my take.
Yes, thank you for that. Do any other panelists have anything to add to that?
Your application. Oh, go ahead. Go ahead.
Go ahead. Go ahead.
Your application tells a story. So, Dr. Rayblatt said it perfectly. I mean, it is, it does kind of jump out at you if you see a bunch of ortho research and then no urology. But I think if you have a really strong letter from a mentor in ortho who knew you really well and can attest to how solid you are, and then you have letters from urologists that have worked with you and they can all attest to that story of how, you were thinking you were going to do orthopedic surgery and you fell in love with urology on your urology rotation. And that happened really late in your third year. And we see, hey, this is a really superstar applicant that we happen to attract to urology. That tells a good story versus having a lot of ortho research, not having really any orthopedic surgery specific letters or any mentors that attest for you, and then having urology letters that aren't super specific or that show that they know you or understand that shift, and a statement that doesn't really talk about it either, then you're kind of left wondering, was this a person that maybe tried to do ortho and felt like that wasn't for them, and maybe there's indecisiveness there. People think so many things, and we build stories in our head about applicants, and as much as we need to stay partial to what's on the page, our brain builds up all these stories. So it's if your narrative can explain why that's the case and turn it into a positive, and everything can be turned into a positive if it was a positive, that's going to be really important. So it's important when you do application polishing, which Urology Unbound can do, or when you meet with your mentors, that you think about that narrative so that it all comes together and people understand why you actually don't have that urology specific research. But if you can and put your name on a project that's significant, that's great, but sometimes we can't, and the story then becomes more important.
And Dr. De La Bonza, I think you were also saying something.
I think I was just seconding what everybody said, which is if you don't have urology research, just make sure that there's other parts of your application that show your commitment to the specialty.
Okay, thank you.
I was going to chime in.
Yes.
Hey, everyone. Sorry, I'm off camera, having some technical difficulties myself. I'm Dr. Wilson. So I like to address this question because I was a applicant who didn't have urology on my application when I got into urology. I came from a school that did not have a home urology program, still doesn't. So to Dr. Santiago Lastra's point, make sure that that narrative is present within the rest of your application. So my letter writers, I know that they talked about my drive for urology, how I made every rotation I was on, I tried to learn and incorporate urology into it, and how I was just an overall dependable, strong student. So, and then I made sure to say, I'm here at a school that does not have a home program, but these are the things that I've done to foster my interest and my education within urology. You also can put your grand rounds presentations that you give on your sub internships on your application, and that shows up as a oral presentation. So you just want to make sure that if you're taking part of the application polishing program, talk about these things with your mentor, because there's ways to make your application reflect what you've done. That also looks really good that we don't always think about if we don't have that first author urology paper. So definitely don't fear if you don't have urology, because it happens to many of us.
Yes, it's good to hear that it's not like a make it or break it situation. And thank you, Dr. Wilson. The next question I'd like to ask is, what are important questions or comments you think applicants should be asking their prospective programs at interviews? I think a lot of times students are just thinking that this is an audition of them, but this is also an opportunity for them to ask their programs, questions so that they can gauge if the program is right for them. And oftentimes students don't know what to ask. And we can start with Dr. Ryblatt.
I don't have a good answer for this one. I think it's, what I'm going to say will sound sort of very boring, but you ask something that you want to know about the program. Something, because, right, we interview a lot and for many years, and a lot of people will ask sort of things that, I don't know, maybe they're on some websites listed as sort of questions to ask. So don't ask those questions. Maybe I'll say the other way. Don't ask questions, what changes you think are going to happen in your program, or what do you think the strengths and the weaknesses are of your program? Those are probably not a very interesting question. I think, well, here's what I would say. If you know where you're interviewing and you know who you're interviewing with, maybe look them up a little bit and know who your interviewers are and ask something specific to them. That shows your interest in the program. that probably would make you stand out and be a little different, because your routine, what things should I ask, that show up on, I've Googled it too, because I'm really curious where those questions come from. That always stands out for me.
I
Or,
agree.
oh, good.
No, I was just gonna say that's 100%. Like, I totally agree with the, Google the person or whoever you're interviewing, so you have a question for them, because look, it's not everybody. If I were back in your shoes and I had to ask questions by the, fourth interviewer, I'd be like, I don't know what to ask. It's the same questions, like, do you have robot? Do you have open? How much research do you do? So all that stuff is on the website, and you have all that information overload from the very beginning. So, you can set yourself apart by knowing who your interviewer is, and then asking them, a question about them. And believe it or not, it doesn't even necessarily have to be something directed to like their research and a very sort of intellectual covered question. It can be something as simple as, hey, Dr. Rich, what's your philosophy on, music in the operating room? What do you like to listen to, or something like that? Because those are little things that will set you apart, and they'll remember, oh, that person asked me that. That's who it was in an interview. So I think, do some background research on the person, and if you're, vibing well with them, asking a question that you feel comfortable like that.
The 5 to 10 year, like what's going to happen in 5 to 10 years is always my least favorite question. Because you don't know, especially as a faculty member. You're sort of like, I wish I knew. I sort of, what have you heard, kind of thing. Sometimes you think about who you're talking to. So if there's someone, a really senior member who's been there for 25 years, you can say something like, you could ask questions about the evolution of the residency program over their tenure there. What do they think has been most important? What are they most proud of with regard to how their residents are trained? What do you could ask the residents if there's any part of their training where they wish it was enhanced, and how so? Like questions that actually have an answer. I think many people in that things are pretty political, and nobody wants to hear, well, this program's turning upside down. That people are going to be sort of socialized to give you a very political answer, which is like, I don't foresee any changes, or I foresee, something positive that you probably could find out from the website.
Anyone else?
I think Dr. Santiago asked for put a comment in the chat. Kind of back to the, just read it.
Yeah.
I
was just echoing. Yeah. I was just echoing what Dr. Rich was saying, Dr. Ryblatt. If you do your research on your interviewers, like really know where they trained, know their research, what they specialize in, and you ask them a question that's specific to them, that gets them to talk about what they're passionate about, and like breaks it up a little bit from the standard questions that people get asked time and time again. I think that is pretty memorable, and it can start getting you into the interview flow, where you actually get your interview to be, really excited and talking to you, and having an actual nice conversation. That's a home run, I think.
Awesome. This is a very direct question that a student asked, which is, what score should we aim for on step 2 to be competitive? And
don't call on me, I don't know.
And yes, that's a very difficult question to ask. I think that you guys answered quite a bit in the first question about, step 2 being weighed more, people blinding out step 1. But if anyone knows, please chime in. And if not, then this is a question that is so specific that we might have to move forward.
I'm gonna sort of make an unpopular decision to answer this question, and I want the students to understand that I'm not saying you have to have this score. there are really stellar students that don't have this score and have turned out to be wonderful residents and doctors. But, you know, I've been to 5 institutions in different capacities, and, you know, it's changed over the years, but things that are, you know, step 1 of around 240 was generally, you know, that person was screened into a lot of interviews. Yeah, I would say that that's a number that you saw. 240 above or above is what you saw frequently on step 1. Now that there is no step 1, you know, I don't have any data to say that it will translate the same in step 2, but I think that that's a number that a person could have in mind. Now, that said, if you get a score that isn't that and you really want to be a urologist, I don't want that to be a deterrent. But just because it can sometimes feel a little hand wavy about the number, and yet so many of us are upset that there is no number, it feels a little disingenuous not to give you something. So I think 240 is really fair. I've had a lot of mentees sort of like move through the application process, sort of like comfortably with regard to interview offers in that range.
So the question I have is step 2 the same numbers? Because that was my impression for step 1. Because
yeah, that was my caveat, which is like that was really the number for step 1,
for step
right?
1. And that's why I meant by saying I don't know what step 2 numbers are, because they historically were a little bit higher range.
Yes.
But I don't know if that's the same case now.
I agree. So, but I think, you know, we're going to have to look at a number. And I would say that the old thinking was if you got a 240 or above on step 2, you had no need to take, step 1, you had no need to take step 2. You could take it if you felt like it. But some people might choose to actually defer it. That used to be the old thinking. And a lot of times when we saw step 2, it was people who weren't exactly satisfied with their step 1 score, looking to show an upward trend. And so really, I guess the real answer that you sort of are drawing out of me, Dr. Reiblatt, is that we often saw step 2 as a comparator. And so we were really looking to see that step 2 was higher than step 1, if that's what you wanted to demonstrate to us. Without that step 1 comparator, I'm going to go out on a limb and say, like, you know, and I have no data for this, but just to give you something in mind, you know, like a 240 might make you feel, you know, comfortable. Yeah.
Okay, I definitely understand what you're saying.
I think if you ask us that next year, maybe we'll give you a little bit more of a solid information.
Yeah, agreed.
Yeah. Okay, I am going to go to the next question. How can a student make up for a deficiency in their application if they're applying the cycle? Things that were brought up is something was difficult as failing step 1, failing a shelf, or lack of research, which we kind of addressed earlier, but failing step and failing a shelf has not come up yet. And those are often very difficult hurdles to overcome.
Would we have a way of knowing that you failed a shelf exam?
How do we know that you
Yeah,
failed?
I don't. Yeah. Sometimes I think students have an idea that we have, unless it's in a committee letter or some way that your medical school would note it on your transcript.
Because it's not, shelves are not on the transcript.
Yeah, I don't think we would know that you failed a shelf exam.
I don't think we know.
Yeah.
Unless somebody who writes you a letter says they failed a shelf, but then they've done so well, and because, I don't know, something happened in your life, and then they retook it. Like, unless it shows up in some sort of a letter, shelves kind of,
yeah.
It may affect your rotation grade if you're at the school where rotations have grades, not pass, fail, but grades. So if your rotation grade is low, I think maybe we can rephrase this in, what if I have 4 rotation grades? How do you, work through that?
Yeah, so that's we actually do have a question about grading and everything, but this will be a good time, I guess, to insert the specifically the failing step, and then also if this affects their rotation grade, and let's say it's lower than a C or a B even in some programs. How could a student try to make up for something like that?
So a failing step is like, this is going to be new territory because the old answer was take it again and show us a higher score, you know, like a really good score if the first one was a non-passing score. I think that the logical answer is obviously take it again and pass, which you'd have to do to apply, and then take step 2 and really try to do well. Just so we're clear for students, what data says about what licensing exams predict for us is your ability to pass board exams. So licensing exams, you know, the American Board of Urology exam and things like that. It doesn't at all tell us whether or not you're going to be a good resident. It's given I think a lot of people have put stock in it, but there's no data that says that it predicts those things. So, you know, if you are really motivated and you really want to be a urologist, then pass and then try to do your best on step 2 and make sure the rest of your application is as strong as it can be.
Any of these things can be a death blow to your application if the rest of it is not really solid. So let's be super realistic about what this means. It's not going to be good, and it's not going to be ignored. It's going to have an impact, and you're going to have to really think about how you're going to right the ship with this event. But I'll tell you on the upside, I have residents that have failed their step and have matched at our program. We've had residents who've not matched their first cycle, who have matched into urology and done really well. We have residents who've not had research experience who have matched. We do not have a single resident who has not honored on their urology rotation who's matched. So there's definitely some things that are expected that you're going to pass them with aplomb. So if you do not have, an honors or a pass on your urology rotation, that's a big red flag. And I think that you're critically in deep waters with that. With everything else, I think, resetting, taking some time and really, having a conversation with your mentors that know you about how to resuscitate your application is important. But it is possible that you may not have the application you need to match that cycle with an event like this if the rest of your application was unremarkable. So it's a time for some really, soul searching, having some difficult conversations with yourself about how much you want to be a urologist and how much you're willing to put in to really right that ship. But there's definitely, if you really feel it in your soul that you want to be a urologist, and I would push back on that for most people because there's so many other things that are brilliant about medicine. Urology is not the only one. But if you really feel like this is your calling and you absolutely must be a urologist, there's always a way to shine and use this adversity and push forward. But you want to really sit down with someone that knows you well, and you want to have a strategic plan as to how you're going to get out of that hole. But it's a big blow. It's definitely a big blow. And it may not be the right move to apply in the cycle if the rest of your application is not stellar.
So when you're saying it might not be right to apply, is this where we get into the conversation of gap years and utilizing those years to really supplement?
Yeah. Or you decide, there's different things that you can do. So gap year is one, but that gap years costs money, and we don't all have that. You can decide to do prelim surgical rotation. So if the question is, it depends where your deficiencies are. If there's a deficiency in research, then doing a research fellowship or taking a gap year to do research might be the way to supplement. If it's a clinical gap, like maybe you struggled clinically and then you're like, okay, you hit your stride a little late and you feel like you can do a better job, but you didn't, maybe doing a prelim year and really getting some really solid letters from clinicians that have seen you operate, that have seen you take care of patients clinically. Maybe that's what you need. I've had many mentees who've not matched and do prelim years and actually match into urology programs after people see how excellent they are. So that is another way to kind of supplement, or just maybe taking the time to really study and ace those exams. Perhaps everybody has a bad day. And so it just depends. There's no formula to what is the best thing to do if you have one of these like extinction level events happen in your career. There's ways to rehabilitate from there, but you have to really sit. The first thing is not to panic or to just push through and hope for the best. Like you have to really sit down and have conversations with people that know you and can give you some tough love and tell you, where you stand. And the time to do it is have a period of mourning for what you've gone through, and then get to it and listen to the feedback to see what your next steps are going to be.
Thank you. And I'm going to ask one more offshoot of this. You mentioned you haven't had one student who didn't honor in urology. Let's say a student does not have a home urology program. Are we looking at how they're performing in their general surgery rotations instead, or what are admissions committees looking at then?
I would say
I'd love to hear what the other people think, because I have a question about that too.
So we've had lots of applicants who don't have a home urology program, and without exception, they've gone to do rotations at places where there is a urology program. And so we lean very heavily on the letters of recommendation. You obviously look at the rest of their grades. And so when you sit down as an admissions committee, you obviously would love if everybody honored everything, but you sort of look at the core areas where you want to see that they did a good job. A surgical specialty, we want to know the people who speak the language of surgery think you do it well and they think that you're well acclimated. Medicine, because we want to see that like you have a good fund of knowledge, you understand the physiology that goes behind all of it. And obviously honoring everything would be wonderful, but those are kind of the ones that people very strongly look at. I don't think anyone can hold it against you, as competitive as medical schools are, that where you were selected doesn't have a home urology program. I think going out of your way to test your interest and make sure that you have the rotations, I think is important.
Okay. Thank you. Did anyone else have anything to add to that?
I have a question for Dr. Rayblatt and Dr. Rich and Dr. De La Banza. So, for students, there can be two things that occur. Students that take a gap year and then come back clinically, and sometimes coming back after a year, there can be a struggle there. So if you actually took a gap year and you don't have a home urology program, you're actually doing your first rotation as an away rotation. And you're being compared to students who may have already done a rotation at that point, because usually the home students get done in that first month, and then the subsequent month is when the away rotators come. And 4 weeks of urology versus 0 weeks of urology, there's a big difference there. And so it's kind of like you're starting a race from behind. So what, do you actually look at that when you evaluate students? Because I accept a lot of students who don't have home urology programs, and I write their letters, so I take that into consideration. But my concern is that people don't. And I've had a lot of conversations with my faculty members, arguments about, you can't, it's apples to oranges sometimes. those 4 weeks or sometimes 8 weeks of difference. So what do you guys think about that? What do you do in your programs to account for that?
I can, when I look back at even some of our residents who didn't have home urology programs and they matched with us, I think that the things that set them apart were always just either their recommendation letters that talked about their work ethic on other rotations, or those who rotated with us. It's really boils down to their work ethic and their ability to interact with other people, sort of like the emotional IQ. Because to be honest with you, I never feel, and a lot of my co-faculty feel the same way, like we don't try to pressure so much how much urology knowledge you know. We don't expect you to be like, citing Campbell's. But if you come in with even if you don't have a home program, but you come in with a clear-cut work ethic, a willingness to, do a good job, be collegial with your peers, be present all the time, and these are little things that make you stand out, even though you may not have the baseline urology experience or knowledge as somebody who is, at the home program and who's doing their rotations there. I honestly think that nothing really trumps a hard worker. You see many applicants, sub-Is and so on, who have an outstanding home urology program, and then they show up on a rotation and it's like they won't even lift a finger to take the patient's leg off of the bed. And something like that is something that stands out way more to faculty when they see that student really didn't engage or help or acted like they were too good to work with the residents. Whereas somebody with no home program, again, may not know anything about urology or very little, but their willingness to work, help, be present, be friendly, that stands out. So I think, to me, that's more important.
I totally agree. Yet, if you take somebody, let's say with similar work ethic, right, or a similar situation, somebody who's done another urology rotation, and for someone who it's a first time on the urology, there is a difference, and it's very palpable. So we definitely remind our faculty saying, this is this person's third sub-I, their first sub-I. And because the difference, and sometimes they'll say, oh, I can't believe he or she didn't know this and that. And I'm like, remember, this is their third day of urology. So we have to ourselves remind ourselves. That being said, especially for your first sub-I, try to prepare as much as you can, right? Read whatever other medical students tell you to read, whatever pocket guides are sort of, in vogue right now. Learn about the program, see if someone else rotated on the program, and you can find them, I don't know, now on social media. We did it other ways, but figure out what are the sort of the quirks of a program to be as prepared, right? If you're gonna, I don't know, I run. So if I run the race, I try to run that course before the real race, just to know where the ups and down hills are. Same idea, try to get as much preparation you can for the away sub-I, especially if you don't have a home sub-I, because you want to be sort of as armored as you can be. And as Dr. Reach said, hard work and being able to, we see it. I can put it like into a rubric with boxes, but you just have that feeling the person is here to work. And that should, like, by third day, you kind
of. Okay. And so the next question, if the school does not have a grading scale or class ranking, and maybe they just had pass fail, and then they have the honors for rotations, does that affect their application? Compared to someone who has grades and you can say, oh, they got an A. Anyone?
Usually the school, when they send the transcript, lets you know that they don't have pass fail. They have pass fail and no honors. Like there's an explanatory paper, or I'm sorry, part of your transcript, so that you know that this person, you have to judge them differently, in which case your letters of recommendation become very, very important. That's just, and other things, research becomes, I would say, more important. Just ways to distinguish yourself become more important. But it's not unprecedented that places don't have any grades. And, so then you look at performance.
We also start looking, and I've always looked at the dean's letter. I always feel that you can do really good on the sub-I because it's almost like it's a sprint, right? You have to sort of do really well for 4 weeks, but can you do that well for 2 years? I think dean letter reflects more of your longitudinal kind of endurance, rather than the 4 weeks I'm trying to impress these 10 people. Also, don't, like, the honors, high pass and pass, those are grades, right? They're just not called A, B, and C. So those are really grades. Another part that I look at, your school will give us like this distribution. You will see certain, and we know these schools, there are certain medical schools where they will give 75% of the class honors or high honors, whatever they call the high grade. And there are certain schools that will give 10% of the class honors and 20% of the class high pass. So in a way, that high pass at the school A could be more valuable than honors at school B. And over time, we know that, plus they show us the distribution. So I pay attention that not every honors are the same. So we spend fair amount of time, especially now, on a dean's letter. Because dean's letter, I don't know if you know, it essentially summarizes your reviews on all your rotations and kind of puts it in the paragraph form. And then there is a summary in the beginning and at the end from the team at your medical school. There's also, most schools still will use that sort of wording at the end of the dean's letter, where it ranks or puts you into, and again, the wording is kind of like that thing on your slide, excellent, good, average, fair, except the words are different, right? There's like outstanding, excellent, good. There's never bad words on that, but you know what it correlates to. So you definitely want to be in the, 20 or, the top 2 quantiles, I guess, of whatever the school breaks down. It, again, as Yahir said, it's an overall picture, but this is a big component. The dean's letter is a big component of your application.
Dr. Richard, I don't know if you had something to say. It looked like you wanted to hop on.
Oh, no, I was just going to say exactly what Dr. Rayblatt said about the dean's letter in that last paragraph. So, you have so many pages of an application to review that a lot of us will hone into that last paragraph from the dean's letter or MSPE, which basically says, in summary, Chad is a good student who stood out among his peers and, is in the X percentile. And so that will typically be where people focus irrespective of the A's and the B's and the C's. That's where that, like she said, the long marathon of 2 years is summarized in how this person should perform in a residency.
Which letters of recommendation are weighted the highest? And what I mean by that is the program director versus someone who is not the program director, and urological versus non-urological. This is definitely a concern for people who don't have a home program, or maybe don't have, they have a lot of experience with someone who was in a specialty that is not related to urology. We can start with Dr. DeLabanza.
So I think a urology letter, now the caveat is if you don't have a home program, everybody understands that. Generally your dean's letter will say it. You can say it at other parts, but all things being equal, a urologist letter, I think, holds more weight than a non-urologist letter usually. If you have a special relationship, you have a research mentor, you're from a program that doesn't have a urology program, you have this wonderful research mentor you've been working with, they sing your praises, you're the best student they've ever seen. A strong letter trumps a lukewarm letter always. I actually think a lukewarm letter is worse than a bad letter. I usually think a bad letter is you rub somebody wrong on one day and they sort of, you know what I mean? Lukewarm is like, I have to write this letter and you're not very memorable overall. A strong letter really makes a difference. And so I always instruct my mentees to ask for the strong letter. Do you feel comfortable writing me a strong, favorable letter of recommendation? Making sure people have your CV and a good draft of your personal statement so that they can make something substantive. They can make comments about you like they know you, as opposed to that short, undetailed, lukewarm letter. It doesn't have to be the superstar. I know there are a few, and we don't have to say their names, chairs around the country that write the worst letters. They're the same letter over and over again. They're unintelligible. They mean absolutely nothing. And it's funny because I think sometimes students seek this person out, not knowing that it's just a lukewarm letter. So really work on those relationships. get a good sense of an exchange. Make sure that you've met with your letter writer and they feel like they know you and they feel comfortable. That would be my advice.
Don't chase people, unless you really know them for whatever your relationship reason is. I know it sounds good that you and a lot of programs will now do a co-signed letter where the program director and the chair will write the joint letter. And one of the reasons is that chairs in general write bad letters. It's nothing personal, it's just the workload and what other stuff there's on the plate of these people. So don't just chase people for their titles. As Dr. De La Banza said, I can name probably a dozen chairs in the country that write the worst letters. I like when I see it, I just flip. The problem is we can't tell you who they are and you don't know who they are. So it's a little bit like but it's not fair. And you can't see your letters. So if you have a good connection with a person, I think that's key. If you've had conversation with a person that, you had the chance to talk about your background. There are also some chairmen who write amazing letters. Like I learned more from their letters than from your personal statements. I love those letters. It's reads like a novel. And God bless those people. But program directors are better, I think, at letter writers than chairs are. It is our job, though, right? Every attending knows that when people rotate with us, it is part of our duty and responsibility to write letters, because that's our duty to advance your career. Doesn't mean we all do it well.
Yeah, I think the urologist letter is very important, that you have to have a urological person. And then program director, definitely that letter tends to be weighted highly. It's always a red flag if you don't have a letter from a program director. But I think most places do. And then the last thing, I can't emphasize this enough, is when you're asking for a letter, make sure that you're asking from a person who you feel knows you well, and you're not just asking them because, I spent a day in the OR and they seem pretty cool, or, I did a presentation, they advised me on it or something. Make sure you've sort of had a connection, you had a conversation with them, so that you do get that good letter and not the lukewarm letter, as was mentioned previously, because, it's tough. We get lots of requests from people, and, we hate to say no, although sometimes we have to, because we don't want to do you an injustice by writing a bad letter. But at the same time, you have to do that due diligence to say, is that person really going to write me a letter, a good letter, a strong letter, and then, go out and ask those people. So the best letters are people who are going to write you a strong letter.
How do you guys feel? I'm going to ask the panelists, letters from sort of private practice urologists. Because occasionally you'll have a letter from just a urology group, and there are some programs that don't have urology departments. But there's a big urology group in town, and the person rotates there. What are your thoughts on it?
I think it's great. I mean, it really depends on how well the person knows the applicant and how well they articulate the letter. What I sometimes find, and it's for sure a bias that I have of academic versus private practice, is I find that sometimes those letters are more generic and they don't have a lot of meat on the bones. And I think that some people have more experience writing letters than others. And obviously people who direct the sub-internships or are the program directors, they know, how to write a really solid letter. And perhaps someone who's in a community practice or a private practice doesn't really have as many students and may not have that kind of honed skill set. That definitely happened to me when I was applying, asking letters from some of my mentors, which were not urologists that were in academia, but were really, knew me really well. And they shared, after the fact, they shared their letters with me, and I was like, yikes, this is like a really cringe letter. It ended up working out just fine, and I matched, so I was very fortunate, but there's varying qualities. So I think if that's the person that knows you, that's your best bet, because they're going to have more knowledge to put in your letter. But you want to be prepared. So when you send someone a request for a letter, you can send them your CV, you can send them your personal statement, and you can even send them a little blurb that says, hi, I just wanted to highlight for you, in case you find it useful for my letter, some of the qualities that I think make me stand out as an applicant, and just bullet point there. Maybe that'll find itself in a copy paste right into your letter. So you never know, because we're busy and any little bit counts. So just kind of be proactive in that, and help your letter writer out so they can really tell the best story about you.
I find that private practice people either have students with them or they don't. And so I have had no issues with low quality letters. What I'm looking for really is a private practice person doesn't usually have a great incentive to have a student, and they are looking for how well integrated you are in the OR or in the clinic, and how thoughtful you are and how proactive. And so sometimes when a private practice person says, I think this person is, sort of gets it and is efficient in a way, I think it says a lot. Because in academic settings, we sort of have an infrastructure to teach. And I feel like if they're well integrated into a private practice, with a private practice mentor who has strong things to say, I think I count it as well as if it's from an academic program. So it's just like what's in the letter, frankly. Like is it a good letter?
Is it true that people on the admissions committee typically don't read a personal statement beyond the first page?
Can I please?
Yes.
Okay. This is like the thing I want to drive home the most. It's not that they don't necessarily, it's that it neatly fits on one page, and it says something about editing and content when it fits on one page. I find that you almost never need 2 pages. So it's not that they don't read it. It's that the ones that are more than 1 page tend to be not very concise, not very focused, and not well edited. I can think of less than 5 personal statements that were more than a page, and it was worth it. The other ones I thought should have had a strong mentor help them pare it down. And I was a person who fought my mentor in medical school. I'm like, I have so much to say. And she really insisted. And she was right. I would say that with good editing, you can really sort of express yourself, really give somebody a good sense of who you are. And it doesn't need to be that long. So if you find yourself at 2 pages, really work with people to edit it down. You want people to hear your whole story.
But don't make it half a page, because that means you didn't care.
Yeah, that's fair. So,
I'm actually going to ask a question that Jonathan asked because it fits perfectly here. What advice do you have for writing a personal statement that stands out? What were some of the things about a personal statement that you read that really blew you away?
They rarely blow us away. Let's be real.
Thank you.
They rarely blow us away. That's not, the goal. It's like a place to showcase yourself a little bit, maybe clarify some things that need to be said about your application that you want to highlight. It's not the time to explain why urology is a great specialty, because we all obviously know that. It's a time to explain yourself and sell yourself in a concise way, and maybe clarify something about you that makes you different from other people, so that we start to imagine again that picture of you in our minds about what makes you tick and what makes you somebody that we want to invite over for an interview.
I was like a good story about just how you got to where you were. That's, just to keep it interesting and fresh, because every time, um, like was being said before, every time you read somebody's personal statement about why urology is great or what cystectomy you saw in the rotation and how cool that was, that's kind of generic. I'd love to hear, how'd you get to where you were? And then, the rest of the stuff academic wise is in the rest of the application. So that part stands out to me.
Yeah, a good personal story.
Especially if you're a non-conventional applicant. I've had students think that they should hide those things. Folks with a work history, folks who have not come by urology easily, folks who, maybe are not from a background where education is common in their families. This is exactly what Dr. Rich is saying. Like, how did you get here? I think is more compelling than, adrenal cortical carcinoma. This is how everyone starts it. Adrenal cortical carcinoma. And then I'm like, okay, here we go. And then they talk about it's interesting, but it's also one of the more rare cases in urology. And, also I'm an FPMRS specialist, so you've alienated me. You know what I mean? So, we all know the interesting breadth of urology. Tell us about yourself. Draw us into your story. I think that's when I've been most compelled, is when I feel like, boy, I can't wait to meet the person who wrote this so I can ask a follow-up question. Those are the most compelling. And those don't get there without editing. So the advice I give is get something on paper. Just blurt it out. Just get a messy rough draft. It can be more than a page, and then have some, divorce your feelings from it and have a few people mark it up, and be open and willing to take advice. Don't wait until the last minute. Don't hide it from people. Don't be shy. Make sure that you get good feedback from sort of trusted mentors.
Okay, thank you. And for the next question, I want to ask, does anyone know for urology, is anyone doing in-person interviews that you know of? I know some other programs are offering it.
Not supposed to. SAU made it very clear. While other specialties will offer, for urology, we should not be offering. If the program offers you an in-person interview, something is off. They can get cited and have issues. So
okay, the next question is off the table.
That's not a question.
Awesome. The next question is, should students inform members of a residency program that they intend to be signaling them?
No, we'll see it on your application.
Yeah, just signal. Yeah.
Great. Someone, Rana, I'm hoping I'm pronouncing that correctly. She asked, and anyone can chime in on this, even other applicants, when is the application due? The AUA timeline is very confusing and lists 3 separate dates. September 1st, September 15th for end of signaling, September 28th for applications available to download. Based on this, she thinks it's the 1st or the 15th, but she's really unsure and wants to let her letter writers know which deadline is actually accurate. Does anyone have any
I don't know
information on that? Any other students want to hop on the chat and help her out with that?
But while maybe someone knows, one comment about signaling to make it clear is you have to signal every program where you did a sub-I, which to me it's illogical, because by doing a sub-I, you're signaling that you're interested, but you have to signal all the programs that you've done the sub-Is. And it's done mainly for a reason. Let's say you've done 4 sub-Is and I've done 1 sub-I. It also gives you opportunity to signal more programs, because your sub-Is kind of don't get signaled. So to eliminate this, you have to signal every program you've done a sub-I at. Because I told my student to say, oh, don't signal us. You already spent a month here. And I was wrong. So I don't want people to make that mistake.
So what were the 3 dates again, just so we're clear? The first was the day it opens. The 15th was...
So September 1st was...
So I'm looking at the website right now.
Huh?
I'm looking at the website right now. Interview offers go out October 27th. So that's pretty late when they're sending out their offers, and most times programs aren't like reading through applications for an entire month.
No, we usually have 2 or 3 weeks. It's very short. Last year was very short.
Very short.
Yeah.
So I don't,
So
I don't
probably
know.
around the time the preference signal is delivered to the programs, the
So
end of
in,
September.
So the programs won't be able to see your application until the 27th. So for your letter writers, they have to submit your letter before then. It doesn't mean that they can't submit it after, but it just means that if they submit it after that date, then you have to ask the programs you applied individually to re-download your application so they get the newest letter that was submitted after they downloaded, and that may or may not happen. So you run the risk of having a letter that's not viewed. But you should still do it if you do a late sub-I and you do really well on that sub-I and you want, you establish a good rapport with someone who's prominent and you are able to get a letter from them, by all means, have them submit it, and you can message programs and tell them there's been an update to my application and I would like to have it be a part of my application, and they can do that. But by and large, those letters should be in before the programs download your application so that it's part of that initial application, so that when you're screened, all of your letters are part of that screening process that takes place after that date. Before that date, from September 1st to the 15th, you are uploading your application materials, and you want to do it as quickly as you can so that you can send your preference signals and take care of all of that stuff. And then, you have several weeks to do it. But you want to make sure that your preference signals are out before that 15th due date. And maybe you're still working on your personal statement. Maybe not all of your letters have come in. That's fine. You can still send out your signals, but you absolutely want to have your letters of recommendation before programs download so that you can be sure that your letters form a part of that initial application that then faculty at the different programs are going to screen to decide whether or not you get an interview.
That was very helpful to me. If there's any questions about this, I would recommend reading the comments and taking that advice that Dr. Santiago just said. Okay. So this is a big question. People often advocate for getting mentors in urology. However, the nature of mentorship is not always well defined. So someone was asking, how do I best make use of the connections with mentors that I currently have? And I think that some people have official mentors, and Dr. Wilson pointed out official mentors usually know what to do with their students to help them. But what about someone who's just, maybe they know a doctor and they've, gotten to know them? What would you recommend as far as, should they specifically ask them to be a mentor, or how best can they use those connections? And I guess I can start with Dr. Rich if he happens to have input.
Sure. No, so mentorship is tricky because, a lot of folks who are really good mentors often have a lot of mentees. And again, it's one of those situations where folks have a hard time telling people, no, I don't want to mentor you, or I can't take you on as a mentor. But so one of the things you have to look out for is, how many people do you see being mentored by that individual? Do you think they have enough space, so to speak, to mentor you? And if it looks like it does, and if you have a good relationship, I think I would come out, directly and ask and say, I'm looking for a mentor. I think that, I'd like to emulate some of the skills that you have and, learn from you. Would you be willing to take me on? And that's the first thing, is just being direct about wanting to be a mentee. And if that person says they have the bandwidth and they say yes, then you want to set up kind of like, not a schedule, but at least say to them, okay, how about we meet once a quarter or month or whatever it is, depending on when this mentorship relationship starts, and trying to set up a little bit of a schedule. And you may not always meet it. It can sometimes be hard because everybody's busy, but at least getting together with that person for coffee. And then, in those few valuable moments you have with the person, getting prepared and having a few questions about rotations, your application, something in that situation. This is all assuming that your mentorship starts kind of within that same year of you applying. Now, if it's a long-term thing, obviously you have more time and you can let that blossom into more of a mentorship. They can guide you to a research project and more advice, and introduce you to people when they're at meetings and network and so on. So that's the other thing, is how can you leverage your mentor's relationship with other people? Hey, I really like this program. Do you know anybody there? Can you introduce me? I think that's, being direct about those things is important.
Anyone else have anything to chime in?
You don't necessarily need to just have one mentor. Sometimes you might use or work with people for different reasons. So, is there a mentor who can help you polish your application, or a mentor who can help you prepare for an interview? Is that might be different than the person who can collaborate with you on a research project. And so I think it's okay to say, I'm very interested in urology. I'm interested in having a mentor. Here are the areas where I think I need help. My personal statement, my application, research. Are there any areas where you think you could help? I think that's a good way to start. And then people can say, oh, I have this project if you're interested, or I spend a lot of time with students working on personal statements. I think it allows them to opt in their areas of strength rather than saying yes to everything just because they feel as if you don't have another option. I think that sometimes happens.
Sorry, one quick thing to add to that and to what I was saying earlier about, selecting a mentor, is also, be wary of the mentorship model where it's the mentor is mentoring you to also help themselves, because you do have, unfortunately, a lot of situations where you will have mentors, who are happy to mentor you, but it also looks good for them, and so they try to get a lot of mentors, or will set up these relationships to make it look like they're doing a lot for you when really they're helping themselves.
Awesome. We're going to move on to the Q&A. I've asked any questions that have come up to me in the chat, but does anyone have any quick questions before we log off for the night? Don't think so. So thank you to our panelists. You guys are just amazing. Gave some really solid and awesome advice. We're just really grateful for you here at Urology Unbound. Thank you to our students who came, and congratulations on getting to this portion of your journey. If you are interested in joining Urology Unbound and heard about us from any of the other collaborating organizations, feel free to scan this QR code and it'll take you to the sign up link so you can be added as a member. If that's it, we have a great evening, everyone.
Good night.
Good night.
Thank you.